Guys, welcome back to Medical Coding with Blue. Today's episode is all about getting additional credentials. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So I didn't say medical coding or health information because this can go several different ways, okay, when it comes to adding on additional credentials, right? But if you're in the health information field, of course, this message is for you. So I had an exchange earlier today with a lady who has a CPC and 5 years of experience. Her employer, now I say this and I emphasize this because this is not true for every employer, okay? But for this lady and her employer has said, we will pay you an hourly differential for having an additional credential. And they didn't tell her which credential to get. So they said, you're free to get any additional credential. We just want you to have 2 credentials on your name, which that tells me that whoever is deciding this is not really looking at the quality of what the person is coming in with as far as additional credentials, because it is quite possible to double up on your credentials and you're already certified as a CPC. Let's just go with that, right? CPC covers all of the chapters, of course, in the CPT book, and it's covering everything. Diagnosis coding, it is covering reimbursement, it's covering auditing, it's covering all of that. And medical terminology and anatomy, it's covering everything, right? But AAPC is a business. It is a for-profit organization, right? And because of that, they are going to market this. They're going to do their best to offer all of these different credentials to folks. And of course, it gets them excited because if they see one credential on their name, they start getting a bunch of them, then it's making people more excited and they're spending more money. You're spending more money. And in this lady's case, she's got this 5 years of experience. She's got her CPC. Her boss, her organization has said, hey, we'll give you additional money per hour if you get an additional credential. So she wrote me asking me what was my opinion on 2 credentials that she was thinking about. And I told her, you're already tested on that with the CPC, okay? Everything you've gone over with the CPC is already covered with those other credentials that you're thinking about getting. So what I would recommend is if you're in this lady's situation where your organization is saying, hey, we'll pay you extra money if you get an additional credential. Okay. This means they're willing to give you more. Okay, then yes, be motivated to get an additional credential. But get certified in something that is not related to what you have there in that credential. The CPC is all outpatient coding. If she came to me and said, hey, Blue, I want to stay with AAPC. I really like it. What do you think if I got the CIC? I would tell her absolutely. Why? Because the CIC, of the Certified Inpatient Coder, is completely different from the CPC. This makes sense to me to be certified in 2 different things and have these 2 credentials, right? Of course, you can go and get certified with the American Health Information Management Association, the CCS, the CCA, or the CCSP. And if she said to me, hey, Blue, I think I really want to try to get the CCS because I have 5 years of experience and I think it would be a good challenge for me. What do you think? I would say yes, because CCS is the gold standard of medical coding credentials. There are people who will say that other credentials are the gold standard, but really nobody and no credential beats the CCS. Now, I'm not saying this to be, arrogant. No, I'm not saying that at all. Quite the opposite. This is an industry thing. Like if you have the CCS, this says you have mastered. This is an industry designation as well, okay? The industry has said this. This says you have mastered inpatient coding and outpatient coding. So you can code anywhere. The person who has a CCS is versatile. They can go anywhere. They can code for the inpatient side. They can code for the outpatient side. They know how to apply DRGs. They know how about present on admission. They know about CPT. They know about modifiers. They know about E&M. They know about ICD-10 PCS, all of these things. So this person is really, really well-rounded. So if somebody had a CPC and they said, well, I want to get the CCS because that is the gold standard. That's the one that everybody wants. And that is one of the best credentials you can have in medical coding. Absolutely. Are you doubling up? Yes, because you're already certified in outpatient coding. Okay. So if you wanted to, you could keep one of the credentials, right? But if you get the CCS, hey, CCS says you can do inpatient coding and outpatient coding. But the CPC says you can only do outpatient coding. Now, there's nothing wrong with the CPC. I know plenty of people that I admire who have the CPC, okay? And they're really good coders. I look at the coder themselves, not the credential that they carry. And so that's how I judge a coder, because everybody gets judged. I get judged, you get judged, everybody gets judged. But I look at the person's intelligence. That's what I look at. Not their user experience, not the credentials all over their name, not if they have a degree, not any of that. I look at the person themselves. And that's just me. So I told this lady, if you wanted to get that, that's totally fine. If you want to get the CDIP, the Clinical Documentation Integrity Practitioner, right? I think that they changed it to integrity. I think it's integrity now. I thought it was improvement. But anyway, it's late, guys. It is late, and I'm trying to finish this up. So I told her about getting the CDIP, which is about clinical documentation improvement, and that she could get that, and it's something completely different from the CPC. Okay, and so that's just an option out there because it's something that she's got the experience, and especially if she's done auditing before, if she's done any kind of education, it's going to go right along with that. But CDI is looking for holes in the documentation. It's not coding, it is looking for the holes. Obviously, you need to know about the coding. You need to have a strong grasp of coding. You need to have a strong grasp of pathophysiology, which a lot of people don't emphasize, but you do. You have to know about the disease process because that is the only way that you're going to be able to see those things, okay? Having a nursing background does help, but it is not everything, all right? You don't have to have it, but it does help, okay? So that was one of the things that I had mentioned to her. So, but it brings up a good point. When is a good time to get additional credentials? So if you've been with my channel for a little while, you know that I had the CCA or the Certified Coding Associate for 13 years. And up until that point, I was perfectly fine having having the CCA. But what ended up happening was I have things changing in the background. So I needed to change my credentials. So I got the CCSP, the Certified Coding Specialist Physician Base. And this says that I have mastered the outpatient setting. Well, I already knew that, but the thing about it was I knew I needed to cover my bases with the inpatient coding side. But I wanted to go ahead and change my credential, which is why I did it at the time, to the CCSP. And so I decided then and there, once I passed it, hey, now I have to go on and pass the CCS, which is the gold standard, and which says I've mastered inpatient coding and outpatient coding, which means that I had to buckle down and study for that inpatient side because I am experienced on the outpatient side. So I wasn't really worried about that. It was more about getting that inpatient side down. So with that, I was able to start studying, and then in November, of course, I sat and passed for the CCS, and here I am, with my 2 credentials. Did I double up? Yes, because I had the CCSP, and could I drop it? Yes, I absolutely could, but I've earned it, so I'm just going to keep it. And a lot of people feel like that, and some people say, well, I'm going to drop it, and I'm only going to keep the CCS, and that's fine too. It's whatever you want to do, okay? Whatever you're comfortable with. I have more than enough resources to maintain my credential with the continuing education units that I have to get, all of them that I have to get, and I'm fine with it. So it doesn't really hurt me to carry another credential because I get all of my CEUs. And so it's not putting me out financially to keep them both, because it all comes out in the wash basically. So, but yes, but again, where I work, does it matter? No, this is a personal thing. But where that lady works, it matters to them. They want them to have additional credentials. I think the idea behind it is that they want them to be motivated to get more education. And so sometimes, hey, if we can motivate you with some money, to get more education, then that's fine with them. They want people to be competent. But getting credentials, additional credentials, does not equate to competence. Okay, so that's something that y'all have to understand. But if you want to get an additional credential, look at the credential that you have. Think about it, what was in it, what was involved in it, and then decide from there. A lot of people say, well, what about the CPB? Okay, so that's a certified professional biller. Now, there are some places that look for it, but when they're looking again for credentials, they're going to ask for the CPC over all of them, right? And I have said in the past that if you have a business and you wanted to put a credential on your name and you're a biller and you wanted to get the CPP, that makes sense to me, right? This is all, of course, my opinion, all right? But if you have your own business, you want to be a little bit more competitive and have some credentials and show that you've invested into the industry as well, that's okay. But to get a CPC and then they say, oh, get a CPP because they have that package, you could, but again, at the same time, you're already being tested for reimbursement with the CPC. And so you want to get something that's going to challenge you and it is going to make you think. And so the person who has the CPC, who wants to get the CIC, that makes sense, right? That makes sense. And what about auditing? Again, if you've had experience being an auditor, if you've had experience already, and that's something that you want to do, I mean, you can weigh the benefits yourself. Look in your area, see if they're asking for that credential, and if they are, and if it's something that you want to pursue, then okay. If it's not something that you want to pursue, but you just want to be impressive on your name, again, that's just a waste. You should really only get additional credentials if it's something that you want to work towards. If you want to work towards CDI, absolutely go for the CDI credentials. If you want to go for the auditing side, by all means, absolutely go for the auditing credentials, But again, are they looking for it? Does it matter? Does it make a difference? Or are they really looking for somebody with a degree? So those are the things that you need to know. Because I've seen people who have a CPCA, brand new to the industry, never have coded before, don't even have their first job yet. And a lot of students were pushed into getting the CPMA, which is the Certified Professional Medical Auditor credential with AAPC. And they said, well, my teacher said I needed to get it. Okay, so what do you know about auditing if you've never been audited? That's what I say. What do you know about auditing if you've never been audited? It would have been different if there was a requirement, a knowledge requirement, experience requirement. That would have been different. But there's not. It's just another credential that you can get. If you study for the test and you pass it, you got it. It doesn't matter that you don't have experience, which I think that there's some point to having experience when you're getting additional credentials. And especially in this field where everything, it's about money. Everything is about money. The credentials, to maintain them with your continuing education units, which you can find free ones, free continuing education units to help you maintain. But then there are credentials like the CPMA that require you to have certain CEUs from certain vendors who can charge you whatever they want to, because you got to get this continuing education unit, right? To be able to report this and to be able to maintain it. So they can charge you whatever they like. So that's the thing that you have to think about, okay? Then there's your membership dues. And with AAPC, you have to pay those membership dues every single year, regardless of whether you have a job or not. You have to pay them. It is $222 per year. And so I think they give you a deal if you pay for both years up front. But for the most part, it's $222 per year. So there's that also to consider. And with AAPC, every credential that you get, it causes your CEU requirements to go up. And it's 2 years, yes, the reporting cycle. And it does cap off at a certain amount, but it does cost you more money. And with my employer, they give us CEUs, free CEUs. We get at least 10, if not 11 per year CEUs, right? Easy. So I can hit my CEU requirement fairly easy. And then I go to conference, which allows me to earn more CEUs. And now, again, this year I'm not going, but there's other things that I will be planning on doing that will help me to get some more CEUs. And so that's always an option if you're out there and that kind of thing. But the additional cost is what you need to think about. Don't get romanticized or, just taken by, oh, let me get all these credentials and look impressive. Not if it's not helping you to advance in some way. Okay? So that's just something you have to think about. And don't look at other people to be like, I want to be like this person and I want to do, I thought my hair was sticking up. I want to be like this person and this person has all these credentials. But you don't know what their knowledge base is. Okay? So it's not always impressive to have all these credentials. You need to make sure that you're well-rounded in your knowledge base, and you need to make sure that you have that down before you start adding on additional credentials. Look at the positions that you want to get into, and if it's a required part of that position, then absolutely. If it's not, and you can go based on your experience and based on your one credential, you'll be further ahead because of it, because you're not having to pay to maintain all these other credentials, unless you're in a company like this lady where they are paying her for her to go and get additional credentials, because sometimes they'll do that. But it all depends. It all depends on where you're working. So that's just something that you guys got to keep in mind when you're out there. But know this, I was able to do quite well for only having one credential for the first 13 years. And I had the CCA at that. The CCA, that there's a lot of ignorant people out there who make ignorant comments about the CCA. I love the CCA, and I will always advocate for the CCA. It doesn't matter what anybody says, because to me, the CCA has the most unique domains, and it's not based on chapter of the CPT book. It's not based on that. It's based on unique domains, different knowledge things that you have to have completed, mastered wise, you're in your mind, in your application of codes to be able to get that credential. It's not the easiest test to pass either. And so that's what I wish a lot of people knew, because sometimes they say, oh, I don't want the CCA and I don't want the CPCA. Okay, you don't know what you're missing out on. CPCAs are just as intelligent too, because they have to learn all this stuff, and a lot of times they're coming in with no experience in medical prior, right? So that's just another thing. But looking at your credentials, don't get wrapped up in getting a bunch of credentials if you don't need them, okay? Take your time, but do invest in learning. Do invest in going to the public library or going on YouTube and watching anatomy videos, medical terminology videos. You can just type in anatomy or medical terminology and you'll see lots of them pop up. Some of my favorite channels are Crash Course on YouTube, right? They have anatomy videos. JJ Medicine is another really great one. So those are some of the things that you can be looking for out there, and those are free resources. And going back to your workbooks and learning with those, that will help you as well. So those are just some things that you need to think about when you're thinking about adding on anything additional. Think it through carefully and do a cost analysis for yourself. Look at how much it's going to increase the amount of CEUs that you have to get in order to maintain it. If you have to get another, membership or whatever, say for instance, you're already certified with AHIMA, but maybe you think you need a CPC, which if you're already certified with AHIMA, CCS, CCA, CCSP, there should be no reason for you to get a CPC. But some people do it, So add on that cost at $222 per year for the membership. Think about all those things. For one credential with AAPC, it is 36 continuing education units. Whereas with AHIMA, if you have the CCA, the CCS, or the CCSP, this is not including the, if you have your degree, your associate's degree or your bachelor's degree, the RHIA or the RHIT, the requirement is higher, but I'm not talking about those. I'm talking about the medical coding certifications. And if you have any one of these, just one, it is 20. So Big difference. 36 and 20 is completely different. And so it's a little bit easier to hit. I'm just saying 20. And it doesn't mean that there's anything with the credential itself. It's just the requirement of the organization. AHIMA is a nonprofit organization, okay? And they are very involved in the laws and health information laws and things like that. So they are up there on Capitol Hill. They're always talking about all the good work that they're doing, you know, in trying to help the laws for health information and make them right and good for everybody. You know, they do that. So there's a lot of prestige to it. Okay, a lot of prestige to this organization, to AHIMA. I love AHIMA. I do. But like any organization, there are things that could improve. You know, one thing I do wish they would bring back is the actual printed journal, the AHIMA journal. Everything's online. I don't like that. I don't like having to stare at the screen all day. I like books, as you can see back here. I love books. And I miss the magazine. I used to get it, you know. And even if I had to pay extra for it, I would. I would if it was an option to bring it back, you know. But I believe they stopped doing that around the pandemic. Yeah. So, but anyway, don't be in a rush. If you're not incentivized any other way to get additional credentials, if it's through your employer and they say, hey, we'll give you, you know, more money if you get another credential, think carefully about something unique from what you have that would help you to be more marketable. The person who has a CPC and decides to get a CIC, you're going to be more marketable because this says that you can go inpatient or outpatient coding. And the CIC is no walk in the park because it's fill in the blank. I'm just saying, you know. So that's, I mean, to get that, that's pretty awesome, you know. And employers are looking for it. There for a while, you know, it was kind of hit and miss. I would see them asking for the CIC, but now I'm seeing a little bit more. So I think that's pretty good. You know, I think that's pretty good. But look at what that credential is. Look what it's all about. Look at the job listings and see if employers are asking for it. If they are not, or you're seeing it few far in between, that's not the credential that you want to get. Okay? Just because a credential is out there and in front of you does not mean you have to get it. It needs to be relevant to what you want to do and help you to advance. Y'all need to look at it like that. These credentials need to help you to advance, not to be all, oh, I just look at my impressive name, but then you can't even code E&M to save yourself. Or you can't even code for same-day surgery, or you couldn't answer a basic question about inpatient coding. You don't understand professional fee and you got caught. I'm just saying, those are things that you need to make sure that you're aware. If you've got all of that, if you want to be the subject matter expert, then you better bring your A game. You better make sure that you're studying. And people think, oh, it's so hard, I'm lost. You're not lost. Think about it. You need to think about what it is that you're trying to accomplish. If you're struggling with coding and you say it's medical terminology, you better be on YouTube looking at them medical terminology videos and those anatomy videos, because I think that's a little bit easier, right? To get that in. But keep in mind, when you're watching videos, you're getting 10% of what you're watching. In the session that you're watching it in, you get 10 minutes of it that you're really listening to it. So make sure that you take frequent breaks in between, so that way you can retain a lot more of that information instead of it, you know, going in one ear and out the other, you know. But the key to adult education is repetition. A lady surgeon I know in ortho said that, wise words, one time, and I was like, yeah, that's true. You know, the key to adult education is repetition. So being consistent and being repetitious and studying and getting better, that's going to help you to be able to read this documentation quickly and know where you're at and know what you're looking at, because that's going to make the huge difference between you and somebody who's not doing that and who's just chasing credentials just to have a bunch of credentials on their name. Because it's funny when I meet people who have a conga line of credentials and I ask them a basic question deer in the headlights. Can't even answer me. I'm just saying. So with that said, I'm going to go ahead and wrap this one up. But yes, think about it, guys. Don't be rushing into it. But if you are being incentivized by your employer, hey, that's great. Take advantage of that motivation and take advantage of that. Okay, they're going to pay for it. Okay, good. Well, let me pick something that's going to make me look good and more well-rounded. Just saying. But that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.